and we're going to talk about detoxing to be prepared for the birth of your baby.
Yes, hi. I trained as a family physician and worked as a family physician for over 20 years, and then discovered functional medicine, which is really a way of looking at the body using systems-based biology.
All right. Let me ask you, if a woman wants to get pregnant and be the best first environment for her baby, what should she do? Do we need to be detoxing ourselves in order to be the best environment for our children?
Well, this is the problem the way I see it. We have, on a daily basis, we read new articles about some of the chemicals in our environment and how they do impact the fetus, the baby, when the baby's born, is already impacted. A lot of the chemicals are neurotoxins. Some of them are cancer-promoting agents. And so we know that these things that are in our environment, which we can't remove, such as, for example, DDT, which has been banned 30 years and yet is still causing harm, are there. And we also know that the World Health Organization has been tracking the state of breast milk for decades and finding it to be polluted. And yet there doesn't seem to be any research on is there anything that could be done for a woman who is planning a pregnancy, or even any woman of childbearing age, to do, is there something that can be done so that there are fewer toxins in the breast milk?
So what's the evidence that, I think we understand that there is no question that there are toxins in our bodies. And so what's so bad about these toxins? What influence do they have on ourselves and on our children?
Well, what we're finding is in a very recent research hasn't even been published, is being presented next month. Three very well-known public health pediatricians, you would call them, researchers that have spent their career looking at public health of children, just published that disability in children is increasing, and in particular, the disability, neurodevelopmental disabilities are increasing in children who are even above the poverty line, seems to be increasing faster than below the poverty line at the moment in the last, I don't know, I think it was 10 years, 20 years. And we have a sense of this because we're hearing the statistics on autism. And the last statistic that I heard quoted was 1 in 33 boys now born, which, you know, every time you hear a statistic seems to be increasing, and there seems to be no end to it. And now we have people actually using telephone polling data to find that the levels or the chance that a child is disabled has been increasing over the last decade or so.
Oh my goodness! You know, the last time we were talking,
we don't know that this is whether this is caused by environmental agents, but it can't be genetics. So it has to be something about what happens to this baby, either in utero or when the baby comes out. And then we have these increasing levels of chemicals we know are neurotoxins, and so it seems prudent to put the two together and to say, is there a way to make our bodies better protected or to lower levels of these pollutants in our bodies, since we know they're in there? And to think about that, at least, because I think that conventional obstetrics is not thinking about that specific issue.
That's so important to understand, you know, the two issues. How do we stop getting the toxins, and how do we get rid of them once we have them? So let's talk a little bit about getting rid of them. How do you detox these toxins in our bodies?
So the idea of you doing something actively, like using a chemical to get them out, isn't much supported by scientific literature at the moment. One study that we do have is where a company that makes an algae called chlorella has used it in pregnant women during pregnancy and found that by the time the baby was born, the breast milk did have lower levels of certain toxins. In this case, it was dioxin. This is the only study, and it was made by the manufacturer. So as we know, these are always studies that we question, but it did show an impact. And so it's it's an avenue worth exploring. The other way to get rid of toxins is to use your body's own detoxification system. The body does this on a daily basis, and so the question is, do we have any idea how to make it more efficient? And we do. We can improve all the ways. So the body will detoxify when the body feels that this is an appropriate time. So number one, not being stressed out, being relaxed, doing a lot more stress reduction than we normally do, puts the body in a place where it is now time to build. It is a time to clean. It is time, clean, rebuild, readjust, rebalance. That's the number one thing to do. Number two is exercise. Exercise seems to be somehow magical. You get new mitochondria, you get more energy, you get better mood. It is a good thing to do for, and this, of course, is supported by literature. We know that women who exercise during pregnancy have better outcomes. And finally, it's going to be about food and about nutrients. We know that the diet should be good during pregnancy, but I don't think that the conventional dietitians have quite realized just how important their profession is. The average American is deficient. Almost 87% of Americans are deficient in at least one vitamin is one of the numbers that I've heard. And so the idea that we're going to eat 8 to 12 servings of carbohydrates, which are not the highest in terms of nutrient density, has got to be wrong. And then in terms of other supplements, most people I find to be vitamin B deficient. The conventional blood tests do not seem to pick up on very many of these things. Frequent ferritin, so the iron stores, are something that's also important for pregnancy. And there's research supporting the fact that women with lower ferritin levels have babies with more learning problems, but there is no conventional guideline or cutoff that says, let's get everybody at, say, above halfway in the normal range so that we know that we have the best chance of having a baby who will not have learning disabilities. So these are the ways that we need the research to go into practice. And we can do this safely. We can increase iron stores, for example, a little bit safely, and I think we should do it and not just look at the fact that someone's in the normal range and let it go at that.
So the testing, is there testing that we can do to find out what is in our bodies?
Yes, I think that, well, testing in terms of chemicals is a little bit difficult. If a person is being exposed to chemicals, it might be worthwhile to do that testing. A farmer, for example, or someone who lives next door to a field that's being sprayed with glyphosate or pesticides might want to have a pesticide level done, and these are available. One of the best labs is called Metametrics. It can be done through them. If a person's working in a printing business, or if a person's on a busy street with a lot of pollution, there are ways to get tested for levels of solvents, levels of whatever the chemical is that is being used. Another approach is to do a genetic test, which is presently fairly inexpensive through a company called 23andMe. And there is a way to use that test to extract the detoxification genes that one has, and to have a sense for how efficient one's detoxification is and how well suited to one's exposure. So if you're, for example, a painter and you use some specific kind of chemical, someone could look at your detoxification panel and say, you know what, of all the things in the world, the type of chemical you're using is something that you don't detoxify well. So you really kind of have to think of doing something else. If you're thinking of being pregnant, you have to seriously think of doing something else. And this, I think, would be a way that we can tailor prenatal care to the specific circumstances of the woman, the couple, because the father is going to be very important in this as well.
So you would recommend looking at the genetics as well as looking at what's actually in your body, as testing as well as you can with that.
The problem with the tests that look at what is in your body is that if you don't detoxify well, you might not be putting it out.
Oh, I see.
And also that a lot of these things get stored not in the blood, but in the fat or the bones. Lead gets stored in bones, so lead levels are somewhat useful, but not as useful as as we would wish. And that this is true for a lot of the chemicals that are in our environment. The ones we talk about as being endocrine disruptors get stored in fat. Fat becomes almost a protective mechanism so that we're not constantly exposed to these things in our blood. And so you could do a level in the blood and not find it. I suppose you could do a fat biopsy, but I don't know who's doing those at the moment.
Oh my goodness. So we almost get to what we call the precautionary principle, where you don't have perfect knowledge of exactly what's happening, but you certainly can have an intelligent approach to preventing toxins entering your body.
Yes, I think that because you could go crazy worrying about these things and realizing that there aren't tests for most of them, then the most important thing to do is at least to have a short list of maybe 5 different things that you're going to have go out, not be in your environment. Pesticides are not going to be a part of your house. You're just going to have to live with your fear of spiders. I'm sorry. I hear this a lot. People are afraid of bugs and feel very uncomfortable, but I would be afraid of the pesticides personally, and I think that we need a good balance that way. You're not going to use harsh cleaning solvents. You're not going to be using a whole lot of cosmetics. Those are all the things that are known to interfere with implantation of the egg, for example, the fertilized egg. They're known to interfere with the baby because they're endocrine disruptors. And so we can look in our environment and pick, along with someone who knows what these things are, pick 3 or 4 things that we're definitely not going to have in our environment, so that we can go ahead and feel a little safer that we're doing what we can. In my particular case, when I was trying to get pregnant with my first baby, I worked in a workplace where it just happened that the paper we were writing on was all no carbon required paper, NCR paper. Well, it turns out that that paper, along with all the receipts, for example, that you get in stores, are loaded with endocrine disruptors. If it's not BPA, it's BPS or something else. So that's the sort of thing that I would have wanted to know. I can't touch that stuff. You know, for example, you could do blood level, or I think it's urine for BPA, and say, oh, look, my levels are really high. Why don't I look in my environment and see what it is that I might be able to get rid of? And it could be one source that's really amazing like that. Like it's the paper at work. You know what to do about that. It's the, you know, I'm working in a store. I was actually considering taking another job. This is a good reason to take another job. So I don't know. I think a lot of people get anxious doing these things on their own. It might be good to have someone to do that with. Or if you're the sort of person who can deal with the uncertainty and the sort of loads of information, then you read a book like Healthy Child, Healthy World and pick some things that you're going to get rid of, that you won't have in your environment, so that you can be healthy.
So what else can we say other than lifestyle changes and putting the onus on women? We need to understand what's in our world, in our society, and in our culture. What do you want to tell
Well,
us?
I think that once you start to eliminate these things, the first thing you realize is that you shouldn't have to be doing this as an individual. And a lot of people, more than half of the pregnancies in this country are still unplanned, and this can happen to any of us, in which case it really is the government that should be protecting us. And it is chemists that should have the ethics in their profession not to be putting out dangerous chemicals and trying to convince themselves that they're okay, and sort of going against science and asking for more proof and more proof. So, you know, we had the example of the cigarette companies that had doctors saying that cigarettes were safe. It became pretty obvious that they were willfully distorting the data. And we need to have chemists not do that sort of thing and have an ethic of green chemistry. They know how to design molecules. They know which molecules interfere with human bodies. It's not a mystery, and it's not something that we need to find out after the fact.
So we as mothers want to fiercely protect our babies, but we need to get involved in the real world to enable that to happen.
That's right. So I think that as a mother, you get a lot of energy directed towards protecting your children, and realizing that you can team up together with other people, and that you can insist that your government also do some of this work. we're paying the taxes, and this is what governments should be for, if anything.
Well, this is what's an important moment to mention Moms Advocating Sustainability, who is our sponsor of this interview. And Mama has put on Modern Moms Health Forums in the past, and now we're online and offering this free to our public and to women. And feel free to come join us at Moms Advocating Sustainability and try and change the system so that our world is safer for all future generations. I want to thank you, Dr. Ashe, for joining us and for being the beacon of good health and ethical action in this world. So thank you so much for being with us.
Thank you for putting this on and for figuring out how it's done. Thanks.
You're welcome.